Researchers say the first comprehensive survey on the health and well-being of trans and non-binary New Zealanders reveals serious health inequalities. The Counting Ourselves report was released last night at a community event in Auckland. Digital journalist Murphy has been reading the report.
As a young person, Felicia Brown-Acton faced severe discrimination because the gender she was assigned at birth did not align with who she is. Leaving school early and home at the age of 16, she struggled to get by and ended up on the streets. Her experiences led her to self-harm and contemplate suicide. It's a common story for trans and non-binary New Zealanders. Counting Ourselves researchers based at the University of Waikato found gender-diverse people are 9 times more likely to report high or very high psychological distress compared to the general population. Principal investigator Dr. Jamie Veal says there are serious issues with the levels of discrimination and violence against trans and non-binary people.
That's perhaps reflected as well in what we see with our quite alarmingly high levels of suicidal thoughts and suicide attempts. So we have more than half of our participants had seriously thought about attempting suicide in the last 12 months.
Those numbers were even higher for gender-diverse people with a disability and for youth. They're statistics that have never before been available. In fact, trans and non-binary people are rarely counted. Most general population surveys in New Zealand, including the country's annual health survey, don't collect information about trans and non-binary people. Counting Ourselves was a chance to fill these gaps. Felicia Brown-Acton is now the director of FINE, an organisation that supports Pacifica gender-diverse people and their whānau. She sees how beaten down trans and non-binary youth still are today.
I fear for what's ahead of us in the future. It's not getting any better. Our people are finding it harder to cope as a result of other people.
The statistics are sobering. Of the more than 1,100 people surveyed, almost a third had experienced sexual violence. Some of those who filled out the survey had never shared their story with anyone else before. Others told of how hard their life was and the support they were giving to suicidal friends.